Deb, tell me about how the feedback that was provided from Te Whatu Ora has impacted on the direction for the quality team.
It has really enabled a focus that's achievable. I think it has provided so much resource to us. I loved the breadth of it, the fact that it was coast-wide, that it was face-to-face, not the only way that you have received feedback, and the way it came together with bright ideas from the consumers, what's working and what's not working. I also really appreciated that and could see quite clearly in the document that it was a partnership, working with all the services that are actively engaged and yet know that we want to be better at engaging to promote a great lifestyle on the West Coast, which includes everything. It includes health, it includes housing, food security, opportunities.
In terms of some of the bright ideas and the what's working and the not's working, I can imagine it would be a staged approach, that there'd be some quick wins and some longer term projects. Can you tell us about those?
I think it's the transport for our patients coming in, because I also now work with consumer feedback, and you know the impact it has when people are travelling from a distance to find that their appointment may have been cancelled, the Hokitika flights haven't happened. But what is really good is when their information comes in, going to the services and they are really wanting to respond. It's coming from the teams as well. How can we make their day of travelling from extensive areas as useful as possible? So it's not just one appointment, they could maybe do the x-ray, they could do a number of things on the day. So we understand the impact it has for family, the support people, for individuals, giving up jobs. You know, it's concerning when we find that people are travelling from Haast, 4 hours, one-way trip. And of course, when they have got appointments, early in the morning, some are leaving early. People coming for day surgery, for instance, and where we can, for those people who don't have supports, we're really trying to work with accommodation, facilitating processes. Karamea is another place, and we are so impacted with weather conditions on the road.
Health is one part of wellbeing, and there are other components that our wellbeing partners play in that overall picture of the quality of life on the coast. So you've already said about transport, that has a big impact on your ability to get to where you need to go for social reasons, educational, connection, for your health appointments, but it's across the whole spectrum.
This mahi that we're doing is coast-wide. And we're working through all the towns, working with our areas where we've got our clinics. And so we really want to be able to build on it and expand it, and so that our people who are living in those areas and those communities are being heard, and they know they're being heard and what the outcomes are.